So why is this so important? Why does it matter, specific to prostate cancer? I mean, this event is all about men's health, and all of the different information that's being presented at the event today is important. But specific to prostate cancer, it's very important to be informed because there really is a lack of awareness about prostate cancer. And it's also important to recognize that there are no symptoms for this disease. Until it's advanced, it's very difficult to detect unless you do the testing, which is the PSA and the DRE, and potentially a biopsy. There's also confusion over this PSA. It stands for prostate-specific antigen. It's a blood test, and there's been some confusion because the United States Preventive Services Task Force back in 2011 dissuaded people from getting the PSA because they don't want to have people get overtreated or undertreated, which is a valid point, but it's important to, since that's the best test that we currently have, it is important to recognize that it's really the only gauge we have for potentially giving a red flag for prostate cancer. And once diagnosed, there really is no best treatment, and that's another reason why this conversation is so important, to really get the information that people need in order to ask the right questions, to get the right information, to understand what's going to be the best option for their specific situation moving forward with managing prostate cancer. If someone decides to go ahead with a treatment, it's important to understand that whenever there's a treatment, there are side effects. So active surveillance is an option for many people, depending on the level of the Gleason score after the biopsy. But if treatment is pursued, there are side effects with every treatment. A lot of people out there think that prostate cancer is one of those diseases that you're not going to die from prostate cancer, you're going to die from something else. In many cases, that is true, but there are 30,000 guys approximately every year who pass away from prostate cancer. So it's an important health issue, and again, very important to pay attention to it. So thanks for being here. Our outline for the conversation today is really covering a lot of information in a little bit of time. So the reason for the slide deck is not to have a presentation, because we really do want to have a conversation, back and forth, questions and answers, that type of thing. But to kind of keep us on track, we've got this path of information that we want to follow, and that's the purpose of these slides. And this gives you a quick snapshot of what we want to cover within the next 2 hours. We'll give a little bit of information on just the basics of prostate cancer, go into the importance of testing and screening and the diagnosis, the options of active surveillance or some other treatments, in addition to the side effects that come with those treatments. We'll talk a little bit about the education and support services that are out there for the prostate cancer community, and hear from a survivor, prostate cancer survivor, and have a little bit of time for a few comments from our sponsors for the community conversation, in addition to more formal question and answer portion of the program at the very end. And some of those folks who are going to help us to present would be Dr. Jason Haffron. He's a urologist with the Michigan Institute of Urology. And then Jim Nadeo is that prostate cancer patient that I referenced before. So Jim will tell his story too, so that'll come a little bit later in the presentation. So starting from just some of the basics, like, what is a prostate? Where is it? What does it do? So this kind of gives you a quick idea of what's going on. So the man's prostate gland is about the size and shape of a walnut, and it's located just below the bladder and just in front of the rectum. And the whole purpose of the prostate is to produce fluid that mixes with sperm. A few stats on the disease. As I mentioned earlier, it's the most common prostate cancer is the most common cancer for men following skin cancer. So it's important to recognize that. It's the second most common cause of death following lung cancer. Nearly 30,000 men die in the U.S. every year of prostate cancer, and there's about more than 200,000 who are diagnosed every year with prostate cancer. And those guys join the ranks of over 2 million men who are currently in the U.S. who have a prostate cancer diagnosis. And it's really important to recognize that as the baby boomer generation ages, that number is going to approach 4 million people in the next 8 years. So by 2024, we'll have more than 8 million men living in the U.S. who are diagnosed with prostate cancer. Some guys are at higher risk for prostate cancer. Age is really the biggest one, and the majority of men with prostate cancer are over 50, with the vast majority, with the majority of that portion, 65 or over. And ethnicity is also an important role. So African American men are more than twice as they're 60% more likely to develop the disease compared to Caucasian men, and they're unfortunately more than twice as likely to die from prostate cancer. If prostate cancer runs in your family, whether your dad, your grandfather, your uncle, brother has prostate cancer, it's important to pay close attention because it does run in the family. And guys who have prostate cancer, it's important to speak up because your sons and nephews have a better chance of getting the disease too. So those are all important things to recognize. Also, veterans, military veterans who served in the Korean War or Vietnam War who may have been exposed to Agent Orange are at a higher risk for developing prostate cancer. And some of the folks who work with chemicals such as firemen who are exposed to debris and dust and chemicals, that type of thing, also at a higher risk for prostate cancer.